there is a problem, a big problem. Assessing a doctor based on the work of an accountant is a problem. Keep listening. Hello, you're welcome to my YouTube channel. My name is Dr. Abraham H. Gaga and this is Touching Lives 247. Today I want to share from a perspective of making an assessment based on the wrong indices. What do I mean? Two medical doctors were sent to two different hospitals. For the purpose of clarity, we will name them as Hospital A and Hospital B. So, the doctor in Hospital A, when he resumed work, saw the enormity of work and he was able to surmount it. High mortality rate, but when this doctor came, he was able to increase the workforce and the quality of health care given in that hospital, so that during his time, he reduced maternal mortality rate, he reduced infant mortality rate, and improved healthcare system in that hospital. So people were actually getting the best treatment and attention that is required from a hospital. In Hospital B, where this second medical doctor was, when he went there, his attention shifted to say, how can I generate funds? I'm here now for the government. And then when patients come to the hospital, people who cannot afford their bills, he tells them that there is no bed, there is no room. So they send them to other hospitals, and by implication, they go to Hospital A. But when rich people come around, he admits them. Medical Doctor B actually was more economical in his approach to medicine. So, in a short time, he raised a lot of funds. He increased the charges for dialysis. He increased the charges for surgery and cesarean section. And even though there were casualties here and there, but at the end of the day, the two hospitals having the same capacity, the doctor managing Hospital B made twice the money that Hospital A made at the end of the year. And it was time for the government to publish the records of the hospitals. And the best hospital for the year, the government said, is Hospital B. Because Hospital B generated more funds than Hospital A. Even though Hospital A have in her record a great medical performance in health standards and death rates, but it did not emerge as the best because they did not make as much as Hospital B. The question is, what is the standard we should use in measuring hospitals or doctors? Should it be their performance on health services or their performance in generating funds for the state? As you ponder on this, I want to bring you to the church. Every denomination, as I speak, in this country, Nigeria, and I am sure other countries in the world, rank the churches they have across their country. Every denomination rates or ranks the churches they have in the country, from the most sustainable to the least sustainable. My brothers and sisters, as Christians, we are called to make disciples. That's our task, that's our calling, that's what Jesus sent us to do. But the churches are ranked to be sustainable based on the financial income they have rather than the disciples they are making. Go and check it out. Every denomination has a ranking that they do. And if you hear a denomination saying, this is the most viable church in our denomination, it's not talking about the church that is producing more disciples. They are talking about the church that is producing the largest amount of funds for us annually. That's how denominations rank. And I am wondering if, as Christians, what should be the measure of our ranking a church to be viable? Is it because they are having more money in offerings and tithe? Or is it because we have believers who are making disciples in that local assembly? No wonder I have pastor friends across denominations, and I tell you sincerely, pastors are giving targets, financial targets to raise in their churches, otherwise they are transferred to other places. Oh yes. So just like banks employ staff and give them targets of customers, bring so number of people, otherwise you can't continue working in this position. Pastors are employed and given target of the amount to raise, not the lives to bring to Christ. The money you need to raise every Sunday. Churches, Christians, we should be ashamed of ourselves. It's time for the church to wake up and discover we are not called to raise funds in church. We were not called to make money things. We were called to make disciples. Doing anything rather than raising disciples in church is out of the picture and the program that God has sent us to do. Money is important. It helps us to evangelize. It helps us to do some other things, but it's not central to the gospel. Not at all. And so churches, denominations, wake up, do the right thing, raise disciples, not raise funds. I pray the Lord will help us. My name is Dr. Abraham H. Gaga, and this is Touching Lives 247. I want to bring to our minds that it's time we use the right indices in the right places. Keep touching lives wherever you are so that together we can build the kingdom of God. God bless you. Bye.